terrible lower back pain.
Okay.
Like, all the time.
What happened?
Nothing really happened. It's something, like, just one day I went to, like, lean down and take off my shoes. Like, I was coming home and I went to take off my shoes, and the pain just, like, went from my lower back and shot to, like, top of my butt, and I just fell on the floor, and I was like, ooh, this is bad. And so I took some time off, and no matter what, I can be laying down in bed and I go to lean up to get out of bed. No pressure on my back, and it still hurts like crazy.
Yeah, neck, lower back, hips, and then the knees as well. Okay. Actually, let me stand up first. I want to go through some range of motion in that low back, okay? So I want you to bend forward at the waist for me, okay? What do you feel?
Like, as soon as I go to start moving, it gets really tight. Like, it just starts to hurt, and then if I come all the way down, it's not that bad, but then as soon as I go to come back up, it's like, it makes it real hard where I can't really move.
Gotcha.
Yeah, it just makes it to where, like, I just want to lay down.
Okay.
It's bad.
Now with that, is that pain staying in here? Does it ever travel down the legs?
Most of the time it stays in the back, but sometimes it will travel, like, to the top of my butt, like midway to my butt.
Okay.
And it will travel down there sometimes,
Okay.
but that's not a lot.
And then if you were to extend back.
Well, it popped a little bit,
I heard
but
that.
yeah, so if I extend back, it's not that bad. It just feels like there's a lot of pressure down there.
Okay.
Like, the pain's not there, but it just feels like a lot of pressure.
Okay, what about to the sides?
That's fine.
And then what about with rotation?
Rotation's fine.
Okay. Let me get you to lay face down on the table. Okay. Alright, so we're going to start off, we're going to scan the body. We're going to go from cervical spine all the way down, checking the leg length, and I'll check the symmetry from the right side to the left side, okay? Let me know if you have any pain or tenderness when I do this. Good. I'll come down here. So when I just bring the boots up, checking the leg length. Yeah, that right leg pulls short. So it's a good amount.
Yeah.
So we'll work on this. We'll get this back balanced. Okay. So what we're gonna do, we're gonna use that massage device, relax everything, and then we'll start with the adjustment. So we're gonna start up top here. Deep breath in and out. Deep breath in and out. Okay.
Oh, that don't feel good.
Okay. Let me get you to sit up on the table and then straddle the table, so one leg on either side. Bring the other arm open over here. Good. Keep your thighs to the table. We're going to first rotate you like this. Look over the shoulder for me. Lay face down again for me, please. Okay, so that right side's still pulling short. But now we're going to drop down to the sacrum here. I'm going to stabilize right here. I want you to raise your right leg up for me. Any pain with that?
Not really.
Alright, relax. Raise the left leg up. Now, how does the left side feel compared to the right?
That one feels hard to do.
This one?
Yeah, it felt hard. Like it felt like that was pulling on my back more.
Okay. So I want you to cross the left foot over the right foot. Good. Table's gonna come off over here. Uncross, and then we're gonna have you bend that knee. Good. Okay, raise that left leg up again for me. How does that feel?
It feels like it's like when it's pulling on my back.
Okay. Getting better. Still pulling a little bit. Let me have you lay on your side. Face me this way, please. Good. Perfect. Good. Flip to the other side. Flat on your back. Coming up. Come forward for me a little bit. Perfect. Okay. Arm up, bring your other arm up here. Deep breath in and out. And relax.
Yeah, like my main thing. See, I really want this done because whenever I say there's like a ball on the floor or something, I can put my feet underneath it and I can lean my upper body on it and I can physically feel my lower back at the very bottom spreading apart, but then it's like it hits a wall. Like it spreads apart and then it feels like it just needs to be yanked. And so that's why like whenever I use the inversion table, it helps, but it needs that extra something. And then I saw this and I was like, man, I need to try this out.
I hear ya. All right. Bring this over. I'm gonna have you lay back. Good. Okay, and then did you play football in college?
I did not. I didn't really have the time. I was doing engineering, so I mean, I guess I could have, but
I was
focusing on that.
Yeah, okay, I mean, you're a pretty big guy. Probably got asked that all the time too.
Oh yeah, especially like going at Alabama, like all the time.
Relax right there. Deep breath in and out for me. We'll sit you up, use that massager. And then we might have to do one more time with that, but we'll check in a moment.
Yeah, because I felt it from like here up. I didn't feel anything down here.
From down there?
Yeah.
Yeah, when I do it the second time, I go at a little bit different angle. I get a lot lower, like you'll see. You won't really notice.
Yeah, I won't notice.
But yeah, I get a lot lower, and then we'll do one more time. Usually it'll get just deeper in, but
Yeah.
so I'm gonna have you come on up and relax right there. Relax. We're gonna use that massager on everything, okay?
Oh yeah. It was like it stretched the muscles out, so it made them like really tight. Does that make sense?
Oh yeah, it does. If I push in here, is there any pressure?
Mm-hmm.
If I push in here, any pressure?
Sure.
Good. Hold on, let me have you stand up though. Go through how we did it in the beginning, forward, backwards. How are things feel?
Right, come forward.
Mm-hmm.
Feels a little better. If I go backwards, it still feels like there's pressure down there. It's like at the very bottom. Like it sounds weird, but I can lean back and push right here.
Mm-hmm.
Like I don't know if I can do it right now. Just pull me apart. No, I can't do it right now, but I can do that a lot, and it'll pop down there.
Yeah.
And that'll relieve some of the pressure, like for like 30 minutes. But other than that, like it starts hurting again. But yeah, I mean, when I lean forward, it feels better. It's not stiff.
Good.
And this other side's still good. This feels more freed up.
Good.
Like kind of stiff. And the back just feels like still a little bit of pressure when I lean back.
All right. So I want to do a few things. All right. Lay face down for me. Actually, let me have you drop down. Perfect right there. Yeah, sometimes you just gotta do a little bit of different techniques. Especially, I mean, like for you, like you're a big guy, so.
Yeah. You know, I always have a lot of pressure on my back like that. Yeah, like that direct pushing.
Mm-hmm.
That's what feels like it's helping a lot.
Good.
so much better.
See, not everyone follows like I always do the same kind of routine because I check like the same way, like when I observe the body and I go through and I make the adjustments. But as you can tell, I mean, at times some people need a little bit more.
Yeah, that's why like you did the wash up great from like here up. It felt wonderful. But I didn't feel anything down below, and that's why I said sometimes when I lean back and I push, it goes down, and then as soon as you start doing the pushing, I could feel it, and that's what felt really good.
Yeah.
Like I just needed a little bit more, I guess, but
That happens.
it felt good. Yeah, that was awesome.